Hi, my name is Jessica Anuszkiewicz, and this is my video presentation for Herb 604, Frequently Used Herbs by Dr. Pengelly and Holly Chittum. So I'm going to give you a basic outline. I'm going to talk about my client, and then I'm going to talk about the 5 herbs that I recommended for her treatment. And then I'm also, with each herb, I'm going to talk about what I could have substituted in place. And then I'm going to talk a little bit about the client as far as her constitution and just maybe some lifestyle changes also that I think that she could make, because I think it's important to view the person holistically and not just look at the symptoms. So my client is 68 years old. She's postmenopausal, and obviously she's a female. I did originally think she was 63, but she's 68. And she has been experiencing hot flashes. And she also has a lot of anxiety. She has depression. She also has a lot of skin problems as far as bruising and cuts on her hand from rushing around a lot. And she's newly retired, and she's a new caretaker for her mother, so who's experiencing dementia and a lot of short-term memory loss issues. So she's kind of irritable from that situation as well. So I was hoping, and she also actually has digestive problems, which may be linked to stress, and she also has she also takes Tums a lot too. So that was the only pharmaceutical that she really takes. She doesn't take anything else. And actually, she was one of the only people I know who doesn't use pharmaceuticals frequently, so I didn't have to really worry about a lot of interactions. So, and I picked relatively safe plants or herbs. So none of them usually even interact. So with some of them do, like if the black cohosh, if you're pregnant. But since she doesn't have that situation going on, that wasn't an issue. So, and with most herbs, of course, you want to rotate them so that if something works for a while, it's good to take a break and then you can go back to it. There's probably a similar herb that you can utilize in place of it temporarily. Or, just get the different phytochemicals, the array of phytochemicals that you can have from using different plants. So, the first plant that I suggested was black cohosh, or Actia racemosa, and I suggested that she use the semi-thin variety, which is chocolate tablets, and I believe they're about 40 milligrams per tablet. And I suggested that she take one every day, according to the packaging, and also wanted her to have a bit of a smaller dose just to try it out. Now, she only complied about 3 times in about a 3-week period, and she had read a lot of things about it being estrogen mimicking properties, and I think that scared her. I did give her a lot of the scientific data that shows that it actually is it's a hormone modulator and anti-anxiety, but she did not necessarily want to use it. I don't know if it was from things that she had read, but she did not comply very much with it. But she did try it out a little bit. She did use it years ago and had success for hot flashes. So the next herb that I suggested for her is Camellia sinensis, or green tea. And green tea is the unfermented leaves of the camellia plant. And black tea is the fermented ones. And it has a lot of catechins in it, and it has fluoride in it, and has a lot of things that are really good for dental health. And it shows that it improves dental caries. It also is a stimulant, and it aids in weight loss. And it's also has a lot of anti-aging type properties to it, and it's very beneficial. So I wanted her to give it a try because I wanted her to substitute it for Coffea arabica, which is coffee, and she does drink a fair amount of coffee, which may contribute to her stomach issues and stress. And she also used to have acid reflux, which she doesn't have anymore. So I didn't recommend peppermint, and I've been telling her to try to stay away from peppermint for the most part, if she has any esophageal issues. So basically with the green tea, she complied very well, and she used it 2 to 3 times over a 3-week period. And after the first week, she actually noticed that she lost 1.5 pounds, and she hasn't lost any weight for quite a while. She does work out 5 times a week, and she does aerobics, she swims, she does weightlifting, she's very active. So theoretically, for the amount that she eats, and then also for how much she exercises, you wouldn't think it would be a problem, even at being 68 years old. So she's very excited about that. She was excited that she had lost some weight. And because I don't know how much she really needs to lose, but her doctor had said something to her, and so she was very concerned about that, her allopath. So basically, she saw improvement in her teeth and gums as well after the first week. And I had her just have the plain green tea, which she was totally fine with. And it's actually, from her having the green tea, she's using sugar a lot less too. And in turn, she's healing her gums and teeth by not using the sugar, and she's been swishing it around, and she's noticed a difference. So I feel there's a lot of success with the green tea. I'm very excited about that. And I probably need to drink more of it myself. And I used to, and then I want to get back into that habit because it is fantastic. So I actually suggested to her that she could put some green tea into the next plant or herb that I suggested, which is Avena sativa or milky oats. And I had her take it as basically as a steel cut oat option, and it's very inexpensive. And these are the steel cut oats that she ate, and she had about a cup, and she had it every day in the morning for about 3 weeks now, and she's going to continue with the green tea and the steel cut oats, she said. And I told her she should combine them if she wants to, but she doesn't have to. And she's been substituting her coffee for the green tea, which is nice. And the steel cut oats, she's been substituting that for some of the other breakfast items that she's had, which most likely pastries and sugary things, possibly, because her sisters like to eat a lot of that too, and so they're always leaving things at the house. And so now she says she prefers the steel cut oats because it gives her long-term energy for about 4 hours, and it helps her through her workouts, and she doesn't even get hungry. It also cleans out her digestive system, and it's helping with mild anxiety. It helps with mild depression, and it's just really good for the skin. And she's a beautiful woman, so she'll just keep maintaining that look. So that's fantastic for her. So I'm happy that she's giving it a try. And then so steel cut oats, if you want to see a picture of them, they look a lot like this. It's the fruit, basically, of the Avena sativa that's harvested. And then also sometimes in oatmeal or oat products, it'll be the entire plant. But I think a lot of times it's the fruiting body like that. So then the next herb that I suggested is rosemary, or Rosmarinus officinalis. And I wanted her to try that so that it would help her have faster memory recall. So if she's put on the spot at the doctor's office with her mother, she can just come up with facts faster, and she says that she experiences some brain fog, so I thought that would help. She did not comply too much with the rosemary. I did give her some things from Frontier Herbs, some leaves, but here's a rosemary plant right here. Mine was not looking too good at the time, but now it's looking a little better. It's been got a little too much water lately. But, and it has a bit of a piney smell to it, so she did not like that flavor, and so she tried some infusions of it, and I had her even crush it up and smell it, and she was supposed to also utilize some rosemary oil, which I don't believe she did either. So she really wasn't that attracted to using the rosemary, so I don't know if she really, benefited from the properties of using the plant. So I'm going to keep trying to get her to use the rosemary oil just as a homeopathic, not as a homeopathic, as aromatherapy, and have her just, smell it and just enjoy it more. And I think she'll get into it a little bit more if she just uses it more. So the rosemary, I think I would have suggested something like ginkgo biloba and she could use an infusion of the ginkgo or also a tincture possibly of it. So I wanted her to, and there's also tablets. There's a lot of different forms of the ginkgo. This is a leaf from downtown Baltimore that I found and dried. It's not fully dried, but, and also have my ginkgo earrings on to help promote my cerebral, enhancement, hopefully. And so ginkgo is something that I would like to try more myself, and I think that my mother, the client, would like it. And then also I actually made a ginkgo cordial for my grandmother to see that she can take during the day when she's not taking any pain medication at night, if she does, so it won't interact. But anyway, ginkgo is an excellent herb. And so moving on now, the next plant that I wanted her to try is chamomile. So the Latin name is Matricaria recutita, and it's a fantastic herb as well. And let's see, here's a picture of it, and it has cute little flowers. They're quite small. And chamomile is it's a topical antiseptic, so you can use it for wound healing. It's also a mild nervine, a mild mild antidepressant, and it also is very good for healing peptic ulcers, which I believe my mother or my client may have. That could be the underlying cause for some of her Tums eating. However, since she started the treatment program, she's only used Tums 2 times in 3 weeks. So she says that she doesn't need to as much, and I believe it's from the chamomile. So she's been doing infusions of it and also using it topically. And I also suggested she use it on her hair because she has blondish hair. And she hasn't tried that yet, but I'm sure she will. I'm going to make her some shampoo or something like that. And so I think that that would be good for her to try. And then, you know, I just want her to, you know, if she has any peptic ulcer issues, I would like to have that healed up, possibly from the use of this, and also give her other herbs to utilize in that, for that situation. And so lastly, the other herb that I wanted her to try out. So we had the green tea, we had the chamomile, we had the milky oats, we had the black cohosh, oh, and then the rosemary. So that's all 5 of them. So basically, a lot of those herbs could synergize. So I told her to do combinations of the chamomile, the green tea, and the oats together if she wanted to. And also, you know, she could have sniffed some rosemary. And so, but I would probably replace the rosemary, like I said, with the ginkgo, and the black cohosh. I would probably replace that with something like ashwagandha, which is Withania somnifera. And I think that would be a good overall tonic. I think she needs more of a tonic than actual hormone modulator, because I think that her healthy diet could actually modulate her hormones as well. So, other things that I would suggest for her is I believe that she's Pitta as far as her constitution in Ayurveda, and I think if she works with that, she can eliminate some of these hot flashes that she has, which are actually just her being hot all the time, regardless whether she had menopause or not. So I think if she addresses that, I have a book called Ayurveda for Women by Dr. Svoboda that I want her to look at. I'm going to have her take a test to figure out her constitution. I'm actually going to have her also look into some of the essential oils with rosemary. And this is an excellent book by Kurt Schnobelt. So, and it's fantastic. I borrowed it from the library and they got O fines on it, but I'm going to keep using it for another couple days. And then also, because of her Pitta constitution, I think that she should try ingesting rose water, which is made from rose petals, but also use rose water on her skin as a bit of a cooling agent. I think she needs things that will cool her down. And then, depending on if I believe she has a peptic ulcer or not, I may or may not suggest bitters, but I think that would be good for her. I gave her a spray one to try out, and as kind of separate from this treatment, but I had given it to her before that. So I told her if she has any problems, then maybe continue to use the chamomile and have some aloe vera or something like that in the smoothie. And then also, I would like her to continue to try the Arnica montana on her skin, because it's excellent for bruising. And then also I wanted her to try some neem toothpaste. And then also my calendula salve that I made. So I want her to try that. And there's also another facial one that she could try too. You get it pretty cheap at Marshall's. I think it was like $3 or $4. Very frugal, but I always seem to have good luck with finding herbs. So basically, I want her to work with her constitution, which is most likely Pitta. I want her to try other herbs too. And just, you know, it's all trial and error. And I welcome any comments or criticism that you have about my video presentation, because I just want to learn as much as possible. And I just want any help I can get, really, because I just find it so fascinating to be able to help other people. And a lot of times I could secretly help myself because I may have similar issues. And I wanted to say that I think there's better living through phytochemistry. And I want you guys to have a fantastic weekend and rest of your summer. And take care.